Welcome to the State of Mind Virtual Speaker Series. This series has been developed to provide education and support to youth, caregivers, and educators during this challenging time. This series is a collaboration between two local nonprofits, 1 in 5 and MindPeace, and various community mental health partners. We're glad you're here to educate yourself and to learn how to keep your brain in a healthy state of mind.
Good day. I'd like to thank both 1 in 5 and MindPeace for the invitation to speak on the State of Mind videos. My name is Dr. Dan Nelson, and I'm at Cincinnati Children's Hospital Medical Center, and I also work for the National Center for School Crisis and Bereavement. Today I want to address concerns that families have as kids think about going back to school. Certainly there are issues with children having dealt with COVID for so very long. It's like a marathon that anxiety, depression, concerns about health is often on a child's mind. We want to encourage families to find a safe and productive way to talk about a child's concerns. So I just want to give you a few pointers or tips that might help. Kids actually do much better when they have the opportunity to talk about things than when they don't. When kids feel like the grown-ups don't feel it's safe to talk about a given topic, but especially concerns about health and safety, they somehow feel less safe. They feel like maybe the grown-ups don't know what they're doing. It's also true that kids actually feel much better knowing what their parents think as well. So having a specific time that's relatively open-ended where you invite your kids to talk about their concerns. Another thing we've learned from talking to kids is that it's often best to start with their concerns rather than giving them information. Sitting down and giving a child a long list of things to think about tends to feel like a lecture, whereas sitting down and going, hey, it's time to get back to school. What are you thinking about? What are your concerns? Many children will have been in a situation of possibly being in virtual school. Now they may be going to school. They may have a change in policies as to how to deal with COVID, and just learning about their concerns and what they think or feel about it is a great idea. It's also true that as adults, when we first hear about kids' problems, we often jump to the solution, trying to reassure our children. Unfortunately, this can happen before a child gets a chance to really tell you about their concerns, and maybe even missing a chance to hear about their strengths and their resiliency. Kids often really enjoy talking about those things. And if they don't bring up their strengths and resiliencies, ways they have of coping that you know they're good at, then you might as well take the opportunity to share that with them. Hey, I've seen what a good job you dealt with this situation or that situation. I saw how you were able to deal with going to school before with these changes. I know you can do a good job now. But if they do have difficulty, say, invite them to come and talk to you about it. The other thing is that they may have concerns, not necessarily for themselves, but for the sibling or other family member or their friends. So taking the time to evaluate not just the child and their concerns, but what concerns they have for other people can be very important and also very reassuring for your child. And then kind of lastly, it's worth talking to your children about good safety practices. Unfortunately, the COVID pandemic is not yet over. We're still dealing with challenges like the new Delta variant. And unfortunately, this particular variant is more infectious. It causes an even greater risk to people's health than the previous variants. So it's okay to tell your children about the importance of masking, about social distancing, and about even asking other people to keep them safe. Because what we know about masks is even though they do help prevent us from getting infections from other people, they're even better at keeping, if I have an infection, keeping somebody else from getting the infection from wearing the mask. And I've seen it said, this isn't a great way to wear a mask, and even this is not. It really has to cover the mask, the nose and mouth. Finally, I really want to talk to you about what we know scientifically about vaccination. Vaccines have been around a really long time. Their safety is very well established in so many different ways scientifically. And even though initially when the COVID vaccines began to come out, we didn't have a lot of information, meaning not a lot of people had taken them in the first few weeks or months, we now have a huge amount of science. Millions and millions of people have safely taken the vaccine. It is not unusual to get a somewhat flu-like response that lasts one day and tends to be mild. No respiratory issues, maybe some aches and pains, maybe a headache. And what's surprising is how often the very next day all the symptoms are gone. And even while you're having those symptoms, say the day after you get the vaccine, you're not in fact infectious at all. You've not taken anything into your body that's infectious. So you might feel ill, but in fact you are not going to infect anyone else. And after a few weeks after the second vaccine, your body now has built up an immunity. Over and over, I hear about a terrible misfortune where people are now getting COVID having not been vaccinated, and they begin to have terrible respiratory problems, and the illness goes on. And it's at that point that they're asking for the vaccine so that they might heal quicker or even survive the virus, because people are still dying from this horrible virus. The vaccine does not work at that point. It's too late. So the time to vaccinate is before you're ever exposed to the virus. Now, it's possible, maybe even likely, that the vaccine will become available to children under 12, probably toward the end of this year or early next year. One thing I want people to understand is once that we have the safety and the effectiveness really well established in this age group, then it'll be safe to give the vaccine. And that won't happen before that. It will not be recommended. This is a population that doesn't necessarily get severely ill from the illness. But I will tell you, 300, maybe 370 children have died who would have survived had they gotten the vaccine. And even more children, about 4,000 children, have endured an illness that has to do with multi-system inflammatory response. This illness, this virus and the illness it causes can cause problems in the brain, the heart, the lungs, so many of the vital organs. That is not true for the vaccine. There's only a handful of people, less than a dozen, who've had serious consequences to the vaccine. And when compared to 600,000 or more people who have died from the illness, and far many more who've been hurt by the virus, because 1 in 4 people who get the virus will have lasting negative health effects. So vaccination is by far the safest thing we can do for ourselves and our family. It's also true for every 10% of adults who get vaccinated, 15% of children will never end up getting the virus. And this is especially important as we reach higher and higher numbers of vaccine, which is how we're going to eliminate this virus, or we're going to adapt to it where our bodies know how to fight the virus and people won't be dying and have serious health concerns. Again, I wish to thank 1 in 5 and MindPeace for inviting me to present. My name is Dan Nelson. It's a pleasure to be here. And should you have questions or concerns, we would invite the opportunity to help you with whatever those are. I do thank you, and thank you for your time and interest.
A special thank you to our State of Mind speakers and to you for joining us. More videos and educational resources can be found at 1 in 5's website. If you feel like you or your child is in need of professional support, therapists are available. Please refer to MindPeace's school-based or community resource page. For a mental health crisis or emergencies, patients and families are encouraged to contact their current mental health provider first. This allows the mental health provider who knows your child best to provide support and direction. If your child does not have a mental health provider and they are experiencing a non-life-threatening mental health crisis, you are encouraged to contact the Psychiatric Intake Response Center at Cincinnati Children's Hospital Medical Center. 513-636-4124. Call 911 or go to the emergency department if you are experiencing a medical emergency, a life-threatening mental health crisis, or are directed to go there by a medical provider. This will help limit the spread of COVID-19 in our community and allow our emergency departments to care for patients with the most critical needs first.